Hey guys, I wanted to share a story with you because oftentimes when we have discussions about how ill-prepared the Trump administration has been in its response to COVID-19, it's usually a discussion that talks about the various bits and pieces of mistakes that he's made throughout his response efforts, the lead up to COVID-19. We've done stories about how Donald Trump disbanded the pandemic task force within his own administration. And this is before COVID-19 was even a big story or something that we predicted would be an issue. But those are things that he did early on. But I think it's important to have like a more comprehensive discussion about all the mistakes that Trump made, because number one, of course, I think it's important to hold anyone, regardless of who the politician is, accountable for his or her actions, especially when it comes to something as serious as saving the lives of our fellow Americans. But it's also important to take a good comprehensive look at what he's done recently and how incredibly slow his response was, and honestly, how damaging the misinformation from his administration has been in keeping people safe. So there was a new investigation done by the Associated Press. I think that they actually did an excellent job giving you a full view of the administration's mistakes. And they start off with how the number one mistake by Trump and members of his administration is that they didn't take the virus seriously in the first place. In fact, through reporting by the AP, we found that the Trump administration actually squandered 2 months before they actually did anything about their response to COVID-19, but more importantly, about making sure that we have the national stockpile of medical equipment that we desperately need to fight a serious pandemic. So also, Trump was so confident that COVID-19 wouldn't be an issue that Secretary of State Mike Pompeo announced as recently as February 7th, that wasn't too long ago, that the government had airlifted, and this is a huge problem, nearly 18 tons of donated respirator masks, surgical masks, gowns, and other medical supplies to China. Now look, I want to be clear about something. I think that humanitarian efforts are incredibly important, and I'm not an advocate for halting those types of humanitarian efforts. So I think it makes sense to help other countries because other countries have certainly helped us in our fight for against COVID-19. However, understand what Pompeo did. The Trump administration didn't think that it would be a problem here in the United States, and they decided, yeah, let's go ahead and ship out all these medical supplies to China because they need it more than we do. We're not going to have to deal with COVID-19. But as we know now, by the nearly 10,000 people who have already died from the virus in the United States, this is a huge issue in our own country, and we didn't even think of our own healthcare professionals to ensure that we had enough medical supplies to keep them safe as they fight to protect us on the front lines. One other finding from the Associated Press was, the issue of the national stockpile of medical equipment itself. This is something that we're supposed to not only have, but it's something that needs to be maintained, meaning that there needs to be maintenance on some of those medical supplies, including ventilators. And if we use some of that medical equipment or medical gear, it's supposed to be replenished. But unfortunately, that wasn't the case. The Associated Press writes that a review of federal purchasing contracts shows federal agencies largely waited until mid-March to begin placing bulk orders of things we really need, including the N95 respirator masks for our healthcare professionals, mechanical ventilators, and other equipment needed by frontline healthcare workers. So not only was our stockpile in questionable shape because it had been depleted and the ventilators hadn't been maintained, but we're also now learning that the Trump administration waited till mid-March to do bulk orders of equipment that we need, including those respirator masks. Also, there was the issue with Trump telling governors that they need to fend for themselves and place their own bids for medical supplies that they need in their own states. This is an incredibly ineffective and inefficient way to do things because you're creating a system in which all of these governors, all 50 governors, are engaged in a bidding war in order to get the equipment and the medical supplies that they need. We are one country, and Trump created this environment in which states are fighting against one another for these limited supplies. And so, oftentimes when we have discussions about unity, it's in the context of don't criticize this person because we need unity. But the person who divides us more than anyone is the commander-in-chief. And it's absolutely devastating in a situation like this when we do need to coordinate and work together as a country, not as 50 separate states, in order to fight this pandemic, right? And it also goes to the point of the importance of a federally, mandated stay-at-home order. If you have a state like California that has a much more aggressive response to COVID-19, and by the way, the number of new cases in California is now, it has plateaued, which is a good sign. Same thing with New York, but California luckily had, a stronger early response. And because of that, we were able to kind of prevent the high numbers that we're seeing in New York. And of course, New York is much more densely populated in a smaller area. But it doesn't matter what individual states do because this is a virus that is incredibly easy to spread. So Trump needs to have or take a leadership role to ensure that every state has a shelter-in-place order. Otherwise, our efforts in some of these blue states mean nothing. As soon as we start to maybe ease some of those stay-at-home restrictions, we're going to fall into the same trap again, where the virus can spread from people traveling to and from some of these red states. So that's something to also keep in mind. So I do also want to go back to the national stockpile because this is the number one issue right now. I mean, you're seeing how much states are struggling with medical supplies that they need. And so the Associated Press wrote that Trump and his appointees have urged state and local governments and hospitals to buy their own masks and breathing machines, saying requests to the dwindling national stockpile should be a last resort. If you can remember, that was what Jared Kushner was also arguing last week, which is so absurd because the whole point of the federal government is to ensure that we are keeping people safe in situations like this, in crises like this. And then when it comes to the ventilators itself, as I had mentioned, they weren't appropriately maintained. And we found that 2,425 ventilators in the national stockpile were out of maintenance. We needed more ventilators than were in the stockpile to begin with. So to know that thousands of those ventilators don't even work is pretty devastating. Also, some state and local officials report receiving some of those broken ventilators and decade-old dry, rotted masks. This is not leadership. This is absolute devastation and an inability to rely on the federal government when you need it the most. And also, here's something to keep in mind because there are all sorts of lucrative government contracts that are given to private companies in order to provide some of these medical supplies. Well, the Associated Press actually reviewed some of those federal contracts, and they found that since 2014, HHS has paid a private company known as Respironics $13.8 million to develop cheaper, less complicated ventilators that could be bought in bulk to replenish the stockpile. So this order was made, this contract was agreed upon back during the Obama administration in 2014. But here's the problem. Turns out that they were not supposed to have those respirators, they weren't gonna have those respirators ready ventilators. They weren't going to have those ventilators ready until 2022. So now the Trump administration is basically providing more money to get the company to provide more of the ventilators early on because we obviously need them absolutely right now. And then the final thing, as we all know, it wasn't until last week that Donald Trump was finally willing to invoke the Defense Production Act, okay? That is the act that pressures private companies to produce the products and the supplies that we need in the middle of a crisis or emergency. I don't know why it took him so long to do that. I know that private companies aren't necessarily in favor of it. I mean, it really depends on which company you're speaking to, but we're in the middle of this crisis and we've been in the middle of this crisis and he was just completely unwilling to invoke that act until the last minute. And I mean, to say last minute is actually pretty deceptive because it's already too late. Think about how many people have already died in the United States over this virus. Those are lives that did not need to be lost. We are putting our healthcare professionals in grave danger because of the lack of preparedness that we're seeing from Donald Trump. And it's not really clear when we're going to get all the ventilators we need. Trump himself said that the ventilators will be ready to go. 100,000 of them will be ready to go soon. But the truth is, according to the Federal Emergency Management Agency, they hedge that the ventilators won't be ready until late June. So we're hearing from Trump that they're likely going to be ready by May. Obviously, you can't trust everything that Trump has said because he's put a lot of misinformation out there. The actual professionals within his administration, some who are actually left, are saying that you can't really expect 100,000 ventilators until late June. So again, we are close to 10,000 Americans dead as a result of this virus. It's very serious. And even though there are still 9 states that refuse to issue stay-at-home orders, I really beg you guys, if you happen to live in one of these red states, please stay home. It's so important for us to prevent the spread of this virus. And in California, they just noted that if you're gonna go out in public, you need to wear some sort of mask or a scarf over your face so you're not spreading it in the case that you might have the virus. It's just something that we really need. We need teamwork. We need people to take it seriously. We need all hands on deck. And we need to drown out the voices that are spreading the misinformation, because at the end of the day, what we need to think about the most is saving lives and preventing people from getting sick in the first place. Anyway, talk to you guys soon.